It would be great if we had vaccines by Christmas, but we might not, and we might need to do more work, and that's why this is a long race. My name is Simon. I run an immunology research team. I'm based at the Women's and Children's Hospital, and it's very inspiring to be doing this work. I think there are two phases now. Having dealt with the crisis actually very well in South Australia, we still need to carry on unpicking the immune system so that we can really learn what mild disease looks like, so that we can maybe try and get more people to not have those severe symptoms. Why some people get lung symptoms, some people get heart symptoms, some people get skin symptoms. So I think that's going to be important to try to understand that and be ready to deal with it. We can't learn more about this disease and how to deal with it without doing basic research. So the two things that make that possible is the willing participation of people who've had COVID and the willing participation of people investing in this research by giving us funding. I quite like the analogy of the bushfire. You only get a bushfire when you have fuel, ignition and oxygen. And I think COVID internationally has been the fuel. The scientists are the ignition to try and deal with it, but the third component is the oxygen, and that really comes from support for us to do that research. It's very easy to think, because the infection rate in South Australia right now is really low, that this is over. And I think that the scientific and medical community is really thinking carefully about next time or next winter. And that means that we've got to keep pushing this. We've got to get the knowledge so that we can better inform clinical treatments and help to understand good vaccines. I really want to take this opportunity to thank the Hospital Research Foundation for their vision in backing us, their preparedness to support this work, which is really important. And without the help of the Hospital Research Foundation, we could not do what we're doing. So thank you very much.